Welcome to Coming Soon, the new Hospice Pepper webinar, hosted by the Visiting Nurse Associations of America. Today's program will be presented by Kimberly Hrehor. Kim is a director with the TMF Health Quality Institute. She manages a contract with CMS to develop, produce, and distribute the Program for Evaluating Payment Patterns Electronic Report, or PEPR, for hospitals and other healthcare providers. She develops training and reference materials to help providers understand and use PEPR. Kim's work experience includes health information management, compliance, and performance improvement. I'd like to turn it over to Kim.
Thank you so much, Heather. I appreciate your having me back. I'm grateful to the VNAA for allowing me this opportunity to talk about the upcoming release of the Hospice PEPR. Again, my name is Kim Hrehor. I work for TMF Health Quality Institute, and we are contracted with the Centers for Medicare and Medicaid Services, or CMS, to develop the PEPRs for hospices. So what I plan to do today is review what's going to be new in the upcoming PEPR release for hospices, which is scheduled to be completed in April. I also plan to review how you can get your PEPR. There's a little bit of an update there, and of course review how you get assistance with the PEPR and some of the other resources that are available for you on our website. So the new PEPR that's going to be released in April, we're scheduled for April the 17th. It's the version Q4 fiscal year 2016, which means that it summarizes statistics for the 3 federal fiscal years of 2014, 2015, and 2016. So remember that every time we produce a new PEPR, we refresh the statistics for all of the time periods included in the PEPR. So it's possible you might see some changes in the numerator or denominator count, or perhaps even the state, national, or jurisdiction percentiles between one release and the next. We do roll the older year off as the new one is added, so keep that in mind as well. I do want to take just a few minutes to talk about the target areas in the PEPR. So I apologize for those of you who may have heard this a few times before, but in the PEPR, what we're doing is we're summarizing statistics for areas that have been identified as prone to improper Medicare payment. We call those target areas. And so those could be improper payments related to coding or billing errors, unnecessary services, those types of things. In our reports, we construct those target areas as a ratio where there is a numerator and a denominator that we use to calculate a target area percent. So in the hospice PEPR, the numerator is the number of episodes or claims or in some instances days that have been identified as potentially problematic. And then in the denominator, we have a larger reference group. For the hospices, the primary concern is the misuse or abuse of the Medicare hospice benefit. Now, those of you who've been using the Hospice PEPR for a long time may recall that early on, the Hospice PEPR only included 2 target areas. And now we've expanded to include a good number of target areas. We do coordinate with CMS on an ongoing basis, and they do make recommendations for us for new areas that they would like us to investigate. So the target areas do change over time. For the Hospice PEPR, we've made some changes in some of the target area definitions. We've made a number of additions. But from time to time, we also retire target areas, although that's not been the case with the Hospice PEPR at this point. So you all may know, probably know, the hospices are reimbursed through the Medicare hospice benefit, which requires the beneficiary to elect the hospice benefit. And there are 4 levels of hospice care: routine home care, continuous home care, GIP, and respite. And so we look at potential risks for all of those types of hospice care. And as I just mentioned, we do coordinate closely with CMS subject matter experts, But we also use national level claims data analysis as well as oversight reports to help guide our target area development. There are a couple of OIG reports that I've listed on this slide. The first one led to the addition of 4 new target areas in the previous year's PEPR, having to do with concerns about site of services for hospice. The one that was released last March was more concerned with the inappropriate use of general inpatient care. General inpatient care is intended to be short-term and may be provided in a hospice inpatient unit, in a hospital, or in a skilled nursing facility for pain control or other acute or chronic symptom management that can't be addressed in other settings, for example, the beneficiary's home. When a beneficiary has a long GIP stay, the concern is whether the GIP is the appropriate level of care and whether the beneficiary's symptoms are being effectively managed by the hospice. So what we've done for this new release of the PEPR is we've added a target area that is focused on long GIP stays. Now here is simply a listing of all of the target areas that are included in the hospice PEPR. And we are adding the long GIP stays. You can see that one at the end of the list there, highlighted in red. So that's the only new target area that is going to be included in the upcoming release of the PEPR. There are not any changes for any of the other target areas. You can see we still have the 3 target areas that are focused on live discharges. There is the one that focused on long length of stay. Then we have the 4 target areas that were added in response to the first OIG report that was listed on that earlier slide, looking at different levels of care in assisted living facilities, nursing facilities, and skilled nursing facilities. We have the claims with a single diagnosis coded, episodes with no GIP or CHC, and the new long GIP stays target area. I've included in the presentation material today the numerator and denominator definition for this new target area. In the numerator, we're identifying what we're calling the long GIP stays. Those are the GIP stays with a length greater than 5 consecutive days. And we are looking at those episodes, the count of stays within episodes ending in the report period, which is the fiscal year. In the denominator, we're counting the total number of GIP stays, which is identified as 1 or more consecutive days of the revenue code 0656, which identifies the GIP. So some of you may be wondering, well, how did you identify the 5 consecutive days as the cutoff for a long GIP stay? There was an OIG study that was published in May of 2013, and it was focused on GIP. It found that 1/3 of the hospice stays were longer than 5 days. So that was one of the factors that we considered. Also, given the fact that inpatient respite care, which is also intended to be short-term, is limited to 5 days, with CMS's approval, we did set this threshold for the long GIP stays as those greater than 5 consecutive days. So that's the new target area in the upcoming PEPR. There are a few other changes that I want to make you aware of. So in the PEPR previous to this new one, we included a top terminal conditions report that identified for all of those beneficiaries who died during the most recent fiscal year, what were those top terminal conditions. And those top terminal conditions were identified based on data reports that were available on the CMS website. These diagnosis categories, the terminal condition categories, were identified through ICD-9 codes. Now, CMS has not updated those reports that are available on their website since 2009. And as we were preparing for this upcoming release of the PEPR, we were coordinating with our CMS contacts, and we asked them if they had done any work to transition the terminal conditions to ICD-10 from ICD-9. Also involved in that discussion, somewhere along the line, the hospice public use file was made available, and we noticed that that report summarized the terminal conditions as PCS diagnosis categories. They put them into five different diagnosis categories. And so ultimately, what we're changing for the top terminal conditions report is we're now moving from the top terminal conditions, the long list that you see there on the left side of your screen, and we're going to be categorizing the top terminal diagnoses into these broader categories based on the clinical classification system, which is a way of collapsing diagnosis codes into larger categories. So we'll have a category for cancer, a category for circulatory or heart disease, a category for dementia, respiratory disease, and stroke. So the good side, what this means is that there are probably going to be more hospices that will have data in their top terminal diagnosis report. However, it's going to be less granular than what you may have seen in your earlier report. I had hoped to be able to have an actual sample top report for the new terminal diagnosis categories. Unfortunately, we're still working on putting together the PEPRs and just beginning the testing period. So I have to use a screenshot from a PEPR for fiscal year 2015, which you can see on the left side of the screen. That's what the report used to look like. On the right side of the screen, I've used a sample report, which is from our jurisdiction. It's summarized at the jurisdiction level. And your PEPR is going to be formatted in a very similar fashion to this. It'll have the total number of decedents for each of those clinical classification system categories. It will also show you the percentage of decedents for that category, and you'll see the average length of stay for your hospice in this report. I recognize that this is a change, a welcome change for some hospices, perhaps not for others, and I do want to stress that it's important to us, the TMF and our team, that we provide useful, helpful information. So as you get together with your hospice, once you get your new PEPR, if you decide that this change was for the worse and you would rather have us go back to a format that is a little bit more granular, we would appreciate receiving that feedback so that we can then coordinate with CMS and let them know how the customers are feeling about this change, and if we want to go back to the other types of categories. So that is a change that's coming for the top terminal conditions report in your PEPR. We're also going to be adding a new report for the hospice that's going to be titled Live Discharges by Type. And again, this report here that's in the screenshot is a jurisdiction report. I just wish I had a sample PEPR. I was hoping I would have one. I just don't have one right now. What we're going to be summarizing in this report for each hospice is the type of live discharges over the most recent 3 fiscal years. So essentially all 3 fiscal years that are summarized in your PEPR, we're going to be looking at the live discharges, and we're going to let you know what percentage of those were no longer terminally ill, what percentage of those were revocations, what percentage were beneficiary transfers, what percentage moved out of service area or were discharged for cause. So you'll be able to identify in your pepper the total number of episodes for each of those live discharge categories. What percentage does that make up of all of the live discharges? And what is the average length of stay for those episodes? Originally, I was going to switch to a sample pepper at this point, but I'm going to have to hold off on that. I do have an older pepper that I can share if someone has some questions at the end of the presentation. I'll be glad to move into a sample pepper, but I don't have these new reports yet ready to preview for you. I apologize for that. So now let's talk about how to obtain your pepper. The pepper is still going to be distributed electronically as a Microsoft Excel workbook, and you will still receive your pepper through the Pepper Resources portal, which is at pepperresources.org. We'll click on the Pepper Distribution, get your pepper link, and review the instructions to get your access the portal. As in previous years, each release is going to be available for approximately 2 years from the original release date. So right now, as we stand here today, if you go to the Pepper Resources portal and log in to get your pepper, you will have your most recent 2 peppers out there. You'll have the Q4-14 pepper and the Q4-15 pepper. Once we release the Q4-16 peppers, the Q4-14 peppers are going to go away. So if you haven't gotten your 14 pepper yet, you might want to go out there and download it, because we'll keep each pepper out there for 2 years. And as a reminder, we can't send those through email because they are considered by CMS to be sensitive data. When you get to the portal, you are still going to need these 2 pieces of information. You're going to need your 6-digit CMS certification number, which is also the PTAN or provider number. And you're going to need a patient control number or a medical record number from a claim for a traditional fee-for-service Medicare beneficiary who received services between July the 1st and September, I see a typo there, September 30th, 2016. What we're changing now is we're giving you a larger time period to identify a patient control number or a medical record number that will be accepted through the portal. Our team has identified that some providers have extreme difficulty in finding a patient control number or a medical record number that's going to be accepted through the portal so that they can get their pepper. What we want to do is we want to make that a little bit easier, hopefully, by making that time period 3 months instead of 1 month. So if you've got patient control number or medical record number between July 1st and September the 30th of 2016, give that a try. It should work. Just as another reminder, each time we put out a new set of peppers, the validation code that you use for the last year's pepper is not going to work for the new pepper. We refresh all of that with each release, and that's just a security measure that we put in place. And as a reminder, those numbers, the control number, the medical record number, are on the UB04 claim form locators 3A and 3B. I think this might be a good spot for me to switch over to our website and do a little demo walkthrough so you can have a better understanding of how to get your pepper. Okay, so this is the pepperresources.org website. This is our home page. I'll scroll down just a little bit. We do make peppers available for a number of other provider types. You can see that the resources for the hospices are available here. For a home health agency, we have that available here. You can click on this pepper distribution, get your pepper link, which brings you to our distribution schedule. We do have the schedule and the method in this table that's at the top of the page. The hospices obtain their pepper through the Pepper Resources portal. So I will click on that link here. it'll bring you to this page. You'll need to fill out the information, certify that you are one of these provider types. I'm going to say I'm the compliance officer. And you'll fill in the other information. Bear with me while I type this in. We'll select hospice. And when you get to this block here, this is where you're going to enter your 6-digit CMS certification number. And it gives you a little hint here. The 3rd digit of this number is going to be a 1. It is for all hospices. I'm going to enter a sample number. And then here you're going to enter your validation code. This is where you're going to put the medical record number or the patient control number from that claim form that you have pulled from that particular time period. And I'm going to go ahead and put 1, 2, 3, 4, 5, 6 as my sample. When you click the submit button, you will be brought to a second screen. And again, somebody played a trick on me on our website, and they took away my account, my sample account that had my sample peppers out here. So this is a secondary account that we use. It would show you here where it says available files. What you'll see is you'll see 2 files that look like this. There'll be Excel files, and there will be hospice peppers there. Both of those files will be there. This sample account has a whole bunch of stuff in here that's just as an example to how much can be put in a pepper portal, I guess. So you'll see your 2 Excel files here. And what you would want to do is you would want to save these Excel files to a location on your computer where you can find them later. Because if you don't, then you're going to have to go through all these steps to access your pepper again. Sometimes I get the question, well, how many times can my pepper be accessed through the portal? Your pepper can be accessed multiple times by multiple people through the portal. That's fine. However it works is for your organization is fine with us. But we always encourage folks to share it or save it to their computer, and that way they don't have to go through all of these steps again to get their pepper. All right. So let me go back to my presentation. Oh, and I should say also that if you're having trouble accessing your pepper through the portal, please don't hesitate to give us a call. To submit a request for assistance through the help desk. We don't want you to be frustrated trying to get your pepper. We want to help you get your pepper. So if you have a need for assistance, submit a request, go back there, through our help desk, which is available at pepperresources.org. I'm going to go back to our website on the Help Contact Us tab and just submit a new request for assistance. Okay, let me go back to my presentation now. So once you get your pepper, first thing I want to stress is that if you see a lot of outlier target areas, red print in your pepper, don't panic. Just because your hospice is an outlier doesn't necessarily mean that anything's going wrong, that you're doing anything improperly, that any compliance issues exist. But we do want you to think about why might your statistics look that way. Do you expect to see, for example, a high percentage of long lengths of stay? Do you expect to see that you have a lot of routine home care provided in an assisted living facility? It certainly may be expected given what you know about your hospice, your patient population, where they reside, that type of thing. So think about what those reasons might be. And if you feel that something isn't quite right, that's when you start to ask some questions and do some investigation. Perhaps sample some claims, review the documentation, review the medical records, and just overall ensure that you're following the best practices even if you're not an outlier. Again, if you need some help, contact us through our help desk. encourage you not to go to other organizations with questions about PEPR. Consultants, etc., sometimes do not give out correct information. So we want you to come to us, come to TMF. We are the authoritative source for information on PEPR. Okay, this is something new that I want to share. We're really excited about this. Last fall, our team was brainstorming on ways that we could help get the word out about the usefulness of PEPR. One of the things that our team came up with was the harvesting, I guess harvest is kind of a strange word, but gathering success stories from providers about how they use their PEPR to help them identify opportunities for improvement. So last fall, we sent out a request to all providers for sharing those success stories, and a number of them have been completed to date. We've made them available on our website, pepperresources.org, and 2 of them have been completed for hospices. So if you're interested in looking over those success stories, there is a success story page that you can get to directly from our homepage on our website and read about those success stories. We also have on our website national and state level data for hospices. Go to our website again. On the data page, you click on the data. There is a whole tab designated for hospices. And on this tab, we have the national level data for all of the target areas. For the top 10 terminal conditions, that report's going to change when we refresh it with the newer terminal conditions categories. We also have state level data for the target areas and for the top 10 terminal conditions. So all of these reports are out here. We update them on an annual basis following each PEPR release. So I would expect that we'll see these reports updated sometime in April. My goal will be to have them updated on or before the time that we release the new hospice PEPRs, April 17th, but we'll see how that goes. We also have these peer group bar charts, which were developed last summer, and these are another resource that we plan to update on an annual basis, so we should be able to see these refreshed as well. So the peer group bar charts will allow the hospices to compare their PEPR statistics to what group they may consider to be their peers. In these bar charts for each of the target areas, we identify the 20th, the 50th, and the 80th national percentile for hospices in 3 categories. We look at location, whether the provider is urban or rural. We look at ownership type, which is physician-owned or for-profit versus nonprofit or church versus government. And then we look at size, and that's simply looking at by number of episodes, the largest in terms of the top third largest with number of episodes, the middle 1/3, and the bottom 1/3. This is an example of what one of those peer group bar charts looks like for one of the target areas. This is for live discharges for revocation. And when you go to the website, the report looks a little different. I've rearranged the graphs so they'll fit better on the slide. But again, you can see for each of these 3 categories, we identify the 80th percentile, the 50th percentile, and the 20th percentile. And so, for example, for this target area, live discharges for revocation, we can see that the smallest 1/3 of hospices have a much higher 80th percentile than the middle 1/3 of providers, and then the largest 1/3 of providers. Quite a difference in that 80th percentile, but it's a way, so if you know you are a small provider, you can use this 80th percentile as as a comparison for this particular target area. If you wanted to compare your statistics to what group you may consider your peers. And similarly, for location, we see differences in the 80th percentile for rural versus urban. They're different here. The rural providers' 50th and 20th percentiles are also higher than the urban providers. And then as far as ownership type goes, the for-profit or physician-owned providers have higher 80th percentiles and 20th percentiles and 50th percentiles than the other groups of government and nonprofit or church. So again, we do plan to update those annually. There are a couple of files that would probably answer some of the questions for you. We have a methodology document out there. It's about a page and a half long, I think. So it's not like you're going to be downloading a book. It's a short methodology that will describe for you how we put this together. And we also have a hospices by peer group file, which will identify for your hospice into which of those categories your hospice was placed. If you find that you disagree with your ownership type or your location, you'll need to contact your CMS regional office coordinator at the link on the slide to get your information updated or corrected. We have a few other resources on our website that I'm not going to go into great detail on today. We have a spreadsheet that identifies the number of hospices in each of the 4 MAC jurisdictions in total, as well as by state. We have recorded PEPR training sessions. Actually, I'm in the process of working on updating all of those. I hope to have those posted by the time we get the PEPRs out as well. There's a sample hospice PEPR out there. When we get a sample for the new release, I'll be putting it out there. Right now, I just don't have one available. History of target area changes. We have some really nice resources related to job aid, site of service codes for the job aid, site of service codes for it's on the NGS job aid, sorry about that, and some other things that you might find helpful. This is a screenshot of our website, which I think we've already taken a look at. So I think, Heather, I've gotten to the end of my material. I know I've kind of didn't have a whole lot to share today since I don't have a sample PEPR, but I do want to make it clear to those who are listening in, if you've got questions about the PEPR itself, I'll be happy to pull up the sample PEPR as one exists currently, and we can talk about that.
Great. Thank you so much, Kim. At this time, we'll move into the question and answer session of today's call. If you have a question, please use the chat feature at the bottom right corner of the screen. We did have a few questions come through while you were talking, so I'll go ahead and get started with those while we wait for additional questions to come through. One general housekeeping item is that we will be sending the slide presentation to all registered attendees as well as a link to this recording following the call. The first content-based question that we have is, the statistics in my PEPR were slightly different in the fiscal year 15 release from the fiscal year 14 release. Why is that?
Fairly common question that we get at the help desk. That will occur because we refresh the statistics for all of the time periods in the PEPR each time we release one. So there may be corrected claims that are submitted from time to time. Late claims sometimes may be submitted. And each time that happens, the paid claims database gets updated. Now, when we download the claims for inclusion in the PEPR, we do that probably the end of January or so for this release of the PEPR. And we'll see any changes that were submitted since the previous download. That will be evident in the PEPR. I will comment that it's more likely that you'll see changes in the numerators or the denominators for the most recent time period, less so for the older time periods, but that would be the reason that those numbers can shift somewhat.
Thanks for that clarification. The next question that we have is, how does Pepper identify when services are provided at a nursing facility or SNF or an ALS?
That's a good question. Also, another common one that we get at our help desk. Just to recap, all of the statistics in the Pepper are calculated based off of the paid UB04 claim forms that are submitted by the hospice to the Medicare Administrative Contractor. So when we are trying to identify the site of service for those 4 target areas that are looking at assisted living facilities or skilled nursing facilities or nursing facilities, we use the site of service code or the Q code that is on the claim form. So depending on how the hospice completes that field, that's what we use to calculate the statistics. In previous webinars, I've had questions posed to me that have to do with state licensure requirements, that the state requires certain facilities to license themselves as a, for example, SNF, or as an assisted living facility. And so that they are concerned that because their statistics for their hospice are high in a particular area, they're worried that they might get targeted for review by some auditing contractor. And what I try to tell these folks is that that is part of knowing your data. So if you know that your state requires that a certain facility is licensed in a certain way, and as a result, your statistics for your Pepper make you appear high compared to the national 80th percentile, don't panic over that. If you know that you're submitting your claims correctly, there is a rational explanation for why your statistics are high. Don't get all tied up in a knot because of that. You understand why it's happening. It's explainable. And chances are all the other hospices in your state are in the same boat as you. Does that help?
I believe that does answer the person's question. It doesn't look like we have any additional questions that have come through at this time. So I think that we can go ahead and wrap up unless we have any last-minute questions that come through. So is there any last parting wisdom that you would like to share, Kim?
Actually, Heather, I almost forgot to make this announcement, and I'm going to go to our website real quick. So a couple of weeks ago, we sent out an email to notify providers that we are planning to conduct webinars to cover or review the new Pepper releases that are going to be completed in April. So I have scheduled an update for the Hospice Pepper. It's on Tuesday, April the 25th at 1 o'clock Central Time. You will need to register for the session. So if you haven't yet done so, please go to our website, click on the Training and Resources page for hospices, and you can register from our website. I do ask those of you who are within one organization, please coordinate internally. We're limited to 1,000 registrations. And so I'd like as many hospices who are interested in participating to have the opportunity to do so. So if you would coordinate internally, I'd really appreciate that. And if you can't attend this session, I am going to be recording it, and it will be posted out here on the Hospice Training and Resources page. We'll be putting that out here in the Pepper Update section.
Great. Thanks, Kim, for sharing that information. If there are no other questions, I'd like to take this time to thank you all for joining us during today's webinar. I'd also like to thank our presenter, Kim, for sharing her expertise, time, and commitment to making this a successful program. Thank you again for your participation, and I hope you have a wonderful afternoon.
Thank you, Heather.